Perfect. Thank you. So first of all, I'd like to thank the Clinical Congress at this time, the Nursing Congress. Just so you know, I was invited to give this lecture, and it has been presented by, we presented this at the AAST, but I think it has a significant amount of ramifications worldwide, but mostly in the US, since gun violence in the US is more than anywhere else. And I'll just give you an introduction. The GATE program is basically what we found is a potential model to reduce firearm crime recidivism nationwide in this country. And what the GATE program is, just in effect, we have kids, and when I say kids, youth, the program starts between the ages of from 14 to the age of 18. If these, what I call children or adolescents, are found with guns either outside the school or in the school property, they tended to, before this program, ended up going to a jail, a youth jail. And then the GATE program was trying to reduce this because it wasn't really successful in rehabilitating these kids. And so they ended up starting the GATE program. Next slide. There's no disclosures to report. There's no financial benefit from this program. Next. So this is one gun death. This is what it looks like. This is the legend. Next. And so there's 12,000 firearm homicides in basically in the United States per year. Approximately, as you all know, there's about 50,000 deaths, 40 or 50,000 deaths, but 50% of these are self-induced. So this is the type of situation we have in the United States. Next. So there's 33,000 gun deaths, or about 40 now. Next. And from the CDC, there's these amount of actual involvements of any sort of penetrating trauma related throughout the states. Next. So we, as you can see, the United States have more than any of these other countries. And in Europe, as well as in Canada, Portugal. So we have 3.5 homicide rates by firearm per 100,000, the highest. Next. Now, when you take a look at the age groups, as you can see, the ranking is on the left side, number one. And then in age groups, as you can see, it's really in this young, it's number 3 of injury deaths in the age group of 15 to 24 and 25 to 34. So it is a significant problem in this age group of adolescents at this time. And of course, suicide rate is third amongst them all. Also from the 10 to 14 range. Next. Now, our Black male teens are at alarming risk. You know, at this point, as we all know, at least in the United States, I don't know if you all know what's going on, but you almost have to have courage to put a slide like this up in the United States these days. Due to the culture of trying to reduce racism. This is not a racist slide. These are factual. This is the Black male teens at alarming risk. Rates of homicide, as you can see in the Black community, is the highest. And with regards to this, what our data has demonstrated is Black homicide through gun violence. Close to greater than 90% is Black on Black. And that's why this program is important, not just for Blacks, but for the Hispanics that we find. It's basically not so much, I don't think, a race issue overall. It also has to do with the impoverishment rate. Next. So this is the youth violence prevention program by the which is sponsored by the CDC. Next. In Michigan, you have a youth violence prevention program. Next. You have a Johns Hopkins. Next. And you have a Virginia Common. These are all different programs that have basically on gun violence on youth throughout the United States. Next. 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 Now, the problem is that with all those programs, I can tell you that the recidivism rate of gun violence, nothing has really come about to decrease the rate of these issues. If anything, things have been going up. As you can see, this was in Chicago just recently, and in Baltimore, just lots of shootings. Next. So the GATE program, and I did not start this program. I'm the trauma medical director at one of the safety net hospitals in South Florida. It's Jackson Memorial Hospital, Ryder Trauma Center at South. We have two centers. We have the main center, the larger hospital, and then we opened up this center 5 years ago, approximately 35 minutes south. And I basically started this program from scratch. And it turns out that the GATE program, which had been started in 1999, it was all about preventing these kids from going to jail. As you can see, the court referred them to juvenile justice system. And so basically, Mimi Sutherland, Elizabeth Sutherland, started this program, very passionate. She retired. She was still here doing the program and invited me to partake with the new trauma center. And they bring, part of the program is bringing the kids here. Next. These kids that are found 14 to 18 years of age, they come twice, they're met in the program twice weekly. What? Please go back. No. They meet twice weekly. Basically, they have, it's 100 hours of exposure to them, 46 classes, and they graduate at 6 months. Now, the key to this program, I think, is that the parents need to be involved. And it turns out we were looking at these numbers and we're still trying to get the numbers, but it appears that a significant amount of these numbers are a one parent home, mostly a mother, single mothers trying to take care of these kids. And I think this has a great influence on these kids that are involved in the juvenile justice system. Next. The program tries to involve and stress, get these kids to have external awareness of what is going on with them, a personal awareness within themselves of what's going on in their lives, and then giving them the realization that they have a certain attitude that they can change and a choice of what they can do. Next. Program evaluation, we basically 10-year retrospective analysis. We were of a cohort of all the program participants, and then we followed them prospectively for another 6 to 12 months after this, this cohort. Next. We cross-reference with the Florida Department of Justice criminal record system for rearrest rates of these kids that went through the program, and stratified for overall criminal charges and firearm specific criminal charges. Next. And so what we found was that in the program completion rates, at 6 months, you know, 36, at least 65% completed it. And then at 12 months, we found 65 completed it also. Next. The recidivism rate, as you can see, reached statistical significance in both aspects, where we had the all-comers recidivism was quite significant as compared to the firearm-related recidivism. But with regards to those that completed the program was significantly less than those that did not complete the program. And next. This is basically similar numbers, except a little bit higher with the 12-month recidivism after they completed the program, but still significant. Just so you understand, next, throughout the country, we looked up at different programs for youth, and the recidivism rate with those programs, with those that completed it, was around 50%. So our program appears to have worked better than any other program in the US. Next. The limitations of the study basically, obviously, is that the rearrest rate database only, some people were lost to follow up after the 18 years of age. So we don't know what has occurred to those those kids, as to whether there's been a significant amount of influence of the program to keep them out of jail after the age after they graduated after 18 years of age. And obviously the long-term follow-up data past 12 months is lacking. Next. So for discussion, it has been in existence for 20 years. It's got one of the lowest recidivism rates for reoffense, both firearm and non-firearm related offenses. It's a potential model for decreasing youth gun violence nationwide. I've put this program in front of our governor, trying to receive funding to use it as a model for 7 different sites around the country where there's a significant amount of gun violence in Florida. Next. And that's really it. Are there any questions?
Thank you very much, Dr. Ginzburg, for the wonderful presentation. Any questions for Dr. Ginzburg?
Yeah, Dr. Stewart.
Okay, there is a question from Dr. Jan Stewart. Could you please unmute your audio?
Yes. I'm not a doctor, but I still have a question. This may be a little bit out of your purview, but I understand that the federal government had or has a ban on funds for looking into guns and gun violence as a public health issue. Is that still in effect?
I don't think it is. Yeah, I don't think it is anymore, because we've received, I'm on the board of directors of Western Trauma Association, and I know that we are now receiving funding for research. But I'm not certain with regards to your exact question. The funding for this program, by the way, was funded by the state, not by federal monies.
Okay, so you didn't get any federal money. Okay.
So I'm not sure.
Thank you.
Any other questions?
Okay, any more questions for Dr.